All right, so once you put the numbing cream on and you're waiting, what is the next steps to be anticipating?
Okay, so first I do a nice cleansing with an antiseptic, and then I put the 20-10-10 BLT numbing cream on, and then I let that set for 10-15 minutes. And then the next step would be to get my threads ready. And on her, I am using some 3.5-inch Nova threads with a 21 gauge needle, and these are bibarb. And the reason they're bibarb is because I want to lift and pull with her, because we're wanting to tighten her abdominal area around her navel, around this area here, and in the lower area. So we're going to do some lifting and some pulling. So the top, and then we're going to come down to the bottom because she has a few little creases around here that is a concern. So we're going to do some pulling out with these, and same here. So we're going to V out. So we're initially going to start with 2, 4, 6, 8 of the bibarbs, and then after that I will have her to stand up, and she will stand up, and I will look at her again, and we will see what is left as far as what needs to have collagen filled in. And then I will use some of the Nova threads. I'm going to use the 29 gauge 1.5-inch sharps, and these are smooth threads. So the purpose of these specific threads are for collagen stimulation. Now, prior to putting in any of the threads, we're going to bathe them in some exosomes to help the collagen production and to make it so much thicker and look better, nice and tight.
From a clinical perspective, what is this pretty common? Like a woman who has several children and then works out like a fiend, but still has excess skin?
It's very common to see this on a lady that has had children, even one child. It's very common, and it's a concern to most women that have this area, and threads combined with exosomes are a fantastic solution for this problem.
I don't think it was mine.
We'll clean again before, obviously we'll clean again. So what we're gonna aim, like we're gonna start right up here, and we're gonna aim down. We're gonna go up, so kind of this way and kind of this way. So we're gonna make a V to pull up. I'm gonna try to put them both in the same.
Is that gonna be on my rib area here?
Not quite that hard.
Okay, are you doing some?
Yep. Pinch up, little stick. This is just lidocaine. Aspirate, make sure we're not in any kind of little vessel.
It also makes them feel better if you're touching them.
That wasn't too bad, was it? Feel that? So you want to roll. I'm using an 18 gauge, and you kind of want to roll it and open up the opening so you can get, because I'm using blunt tipped cannulas. I'm not using sharps today. So I want to make that opening as nice as I can right there. Best for you.
No, that's fine.
Can you hold up the exosomes? I wanted to zoom in a little bit.
So we want to do the blunt end up, and how you know the blunt end is up is you can see where the thread comes up and out and up. So the blunt end is on the bottom, so it's like a little spoon right there.
So you injected a little bit of exosome into the
Catheter, and you can see it right here. See the redness at the very tip?
Can you hold it over the white? Maybe it'll focus better.
Tiny little bit of redness right there.
Yeah.
Perfect. And the exosomes are all through the thread. It is soaking in the thread, and we have just like a little spoon at the very end. And then we're going to take this, and we're going to place it right in here. So we just want to pinch up. You feel any of that, Debbie? We're gonna V. We're aiming for right through here, and we're gonna do another one right through there. So this is gonna go into the subdermal. You okay, Debbie?
Oh, I feel that.
You feel it? We're right here.
Yeah, I can feel that.
You're fine. We're just gonna remove. Perfect. Now we have the thread exposed here. So where we went, I'm just gonna hold the thread and I'm just gonna rub, Debbie. You feel that little bit of popping? That's just the thread popping, completely
Feel that?
fine.
Yeah, a little bit.
Okay.
Now, see if it's anchored. And it is. We pull on it. Nice and tight.
Yeah, I feel that.
Yeah? Now, is it painful? Are you okay?
No, I'm okay. But I can feel you pulling.
You've gone, that's the worst part. We're going to go right into the same spot.
So I don't know if you want to see this as well on the site. So you can see now as you crank it up, they're coming out. They're now at 2.5, they're coming out. And then when we're down, you can go out and see them disappear. Now he's still getting a response, but
Okay, right here's where we're at, the end of the thread.
Yeah, I felt you going in.
You all right? So this one went through here, this one's going here. So now we're just got it where we need it. Perfect.
guideline, just like it's the Bible. There's like
So the little,
I feel when you pull the thread and stuff.
so
Yeah,
anchored
that I feel.
very nicely, very nice. These are going to lift and pull. These are going to lift and pull, just V'd. Then down here, we're going to V them out to tighten this. So we're trying to lift, and then I'm going to put two right here to just pull straight up. Hasty?
So while she's preparing that, can you tell me what it felt like when she was putting them in?
You don't really feel too much while she's putting it in until she hits a certain point towards the very end.
Okay.
And then when she pulls, that's when you felt kind of like a little tugging. It's hard to explain. It's just like a little tugging pull on it where you can feel him pulling it up.
Okay.
It's not painful. It's just kind of a different sensation, awkward.
You feel it?
Trying not to.
Okay. It's going perfect. Cool. See the exosomes right there? It's liquid at the very bottom.
Okay. Oh, is
See
that
it
what
right
that
there?
is?
Yeah. Those are exosomes.
if somebody's on your table spending already $100+ they're likely to do what you tell them to do.
Strange, really.
Kind of an odd feeling,
It
isn't it?
is. It's a very odd feeling.
Now see when we pull on that, that's exactly what you were pulling before. So those are gonna be perfect. Now these you want to keep these kind of low because you don't want to get up into the respiratory cavity. So I'm gonna kind of keep these kind of low.
Okay.
So I probably will have quite a bit of thread sticking out. Quick. I like seeing the liquid in the little spoon at the end. That way I know that it's exactly what I need.
The same barbs for downward Just like you did for the oblique. Okay.
Exact same ones.
If you guys want to feel, it's antimicrobial, so if you want to just touch it, you can feel this is not thin in anything either. It's just
Okay. Yep. Angle here. I'm going to stay really close to the surface.
So I'm thinking you can do this with reflexology at the same time.
So we're right here,
With,
right where we want to be.
you can do a lot.
I used to go to a dentist, get this.
It's been people half the time fall asleep when they're off when they're doing electrolytes. So
We have a
Perfect. Right there's where we want to end up because that's what, see, that's where her problem is.
Ours really, there's kind of a stretch to them, so it really is tight, tight contact.
Absolutely perfect.
How come when you pull the catheter out, the barb doesn't, the suture doesn't come right with it?
Because it is on the end and it's flipped up. When I'll pull the next one out, I'll show you. So it doesn't come out because there's about that much of the suture that's looped around.
Okay.
See, she has got such perfect abs that I can see exactly where we're at. Perfect. Perfect. That little blanching is just the epinephrine. That little white. Remember I told you to have a little bit of blanching? That's just the epi.
Okay.
No problem there.
now you'll do his forehead. Okay.
You have to be kind of careful. You don't want to get into any little vessels, and we're just going very, very subdermal. We are not going deep here. And deep enough, about that deep on the needle,
Okay.
because you don't want to go too deep. Get that bevel up. Yep. See the liquid right there on the bottom? And keep it nice and subdermal. Perfect.
And I like to put it up on the forehead and then rub it down the nose so I don't squirt them in the eye.
Straight out.
Now, if you guys watch us
So would you say you're maybe
later, you can get
2 millimeters, 3 millimeters below the skin surface?
messages to do that to people.
I would say that I am the end of that 18 gauge times 2, so I would say that we're probably between 3 and 4 millimeters.
Okay.
And I like to go right back into the same hole when I'm in the same area with a patient because I don't like to cause any more trauma than is absolutely necessary. And so you can put multiple threads in one hole. There's no problem with that. You can feel right where we're at there. Right there. These are all bathed in exosomes, and we have 2, 4, 6, 8, 10 of the 21 gauge bibarb threads. And these are for lifting and pulling and to give her support. And these threads will cause collagen formation around them. And the collagen will form in the next 60 days, and the threads will dissolve. But the collagen will have formed, and it will keep everything pulled back and nice and tight. Basic suture removal kit that I use. You need sterile scissors to cut those threads. So.
I like to start everybody at 1, see his response, and then adjust from there.
whenever your face starts to feel tighter and just start
What's the pressure?
Because I'm over a beard, I'm gonna turn it up to 1.5 and just see, make sure he's still fine with that. The pressure is literally just gliding. You're
It's just a weird feeling.
So you have full contact.
You okay?
See my
Yeah.
fingers even?
It is odd.
You just wanna make sure it's always keeping.
So when you clip the threads, you want to push down because you want the thread to end up underneath the tissue.
If I'm flinging,
So, like as I cut this thread, I want to pull it up and then I want to take my sterile scissors, push down and do a nice little clip. And so then we want to rub out this little creasy. Don't want her to have that. Same thing over here.
now I like to stop right here and do this area as a separate.
Now, Debbie, it's common over the next few days to feel a little pop, and that's just a suture. It's not a thread breaking, it's just a little anchor popping out.
Put on another layer of that serum.
These are sharps, and the thread is inside.
I didn't find out about the O shot.
The 29 gauge, 1.5 inch, and these are sharps. This is a smooth thread. Has no barbs on it. Here's a picture of the thread actually. Now the purpose of these is just collagen stimulation.
It's the only place I don't split it.
Now, what would it be like to? All right, so what are you doing here?
So I'm injecting some exosomes down into the suture. Perfect. I'm doing just a tiny, tiny, tiny little straight down. And then letting it run down and pulling it out. These are very, very shallow. The others were a little deeper. These are very shallow.
They're short too.
They are. That's why we're putting them in this area.
Sensitive in that area.
Very sensitive. Yes, I do. When I do formal trainings and certify people, yes.
Actually pull it out? Because I see that you leave them for a little bit.
Oh, I'm just leaving them because it's convenient for me.
Oh, okay.
I don't think there's really any stretch with these smooth ones, right?
There's not.
It's more of the initiation of.
It's the collagen formation that I'm looking for with this. It's really not.
Oh,
But these ones is more to stimulate that new formation of new tissue.
Yes.
And then it just gives it a better block.
If you just shook it all up in one bottle before and then as you
No,
go.
I never do it that way. I just keep the blood separate. I think mostly so that I know how much is there. Just otherwise it's kind of mess trying to get into a syringe or you know what I mean. But if you just have your serum there, just put a little.
And I'm just tipping them up.
surgically, is there even this kind of an option?
They can do like a tummy tuck, but you're left with a scar, one. And two, can you tighten everything? It's kind of difficult, unless you've got multiple incisions. With a tummy tuck, they usually go very low and pull it down like that. But she's wanting her belly button shaped, and it's harder to do with that. With threads, it's much easier to go in multiple areas without an incision and without the pain, and then the scars at the end, because the threads will leave no scars at the end. These, within 24, 48 hours, you won't even be able to tell that she had anything done.
When it comes to cost of a tummy tuck versus this, what is the ranges?
Tummy tucks, 30 to 50.
What?
30
Whoa.
to 50. 30 to 50. In Knoxville, Tennessee, it's 30 to 50, depending on what you want done.
Okay. And then something like this?
Something like this is going to be around 3,000 to 4,000. So a tenth of the cost.
Yeah.
And no downtime, no pain. She could go back to work tomorrow. You had a tummy tuck, you're out for at least a week.
Oh, she is going back to work tomorrow.
What? Oh my goodness.
Now you can't lift the kids for a week, right?
See, I'm sensing that you need a doctor's order to not go back to work. Am I sensing that? Maybe?
Yeah, well,
So this just feels like acupuncture?
I've never had acupuncture, but I'm assuming this is what it feels like. It's a prick. You know, some areas are a little more sensitive. I'm assuming just part of your stomach.
Are you actually doing a pull when are you doing a
No,
stretch?
these are smooth threads. I'm just doing it for collagen stimulation. The threads will cause collagen to form, and then we're just gonna pull them all out.
Is my dad okay?
He just had infiltration of his IV.
So if you do a typical abdominal, a typical face.
I block off an hour, but most of that is for numbing for the patient.
And what gauge needle is this?
30 gauge. She's getting a 30 gauge, half-inch. I'm just gonna do putting some exosomes.
So a 30
around
gauge
through
with
here.
stem cells would be a problem, because it could lyse the cells, but with exosomes,
Yeah, not
Chinese
a.
needle.
I've blabbed it up a little bit around there, and that's where your additional exosomes went. It's right in there. So as far as aftercare, I don't want you to do any heavy workouts, no heavy lifting, no bending, no stretching, no crunches, anything like that for a week. 1 week, 7 full days. So you don't lift anything over 5 pounds, because we want those sutures, those threads that I put in there, we want those to stay exactly where I have them, because that's where we need them. And so if you did some stretches or some lifting or pulling, you could possibly pull or move it out of place. And after a full 7 days, they're pretty much where they need. They're pretty much there, and some collagen has started to form that's going to hold it there. Walk on the treadmill. Shopping, cooking, your everyday things. Just no heavy lifting at